So this video is on herpes zoster, also known as shingles. It's herpes virus type 3. This is a viral infection with the virus, that initially causes chickenpox in kids, and then it goes dormant and it lives in the sensory neurons, and then it comes out in the sensory dendrites, and you get painful fluid-filled blisters. Pain is the more important thing to most people than the blisters. It happens according to your textbook, and this is on page 153 of your textbook, and then again on page 205. It's in the book twice, but it's here with the herpes. It says that there's about 4 million cases of chickenpox per year before the vaccine, and about 10 to 20% of the population get the shingles, which follows that. So that means about 500,000 cases a year. It doesn't really happen more than once to people, although people that get it are terrified that it will happen again. The exception being immunocompromised people. Now, that sounds like a pretty big exception, except in this target population, and these are generally people over 55 or 60 that get shingles. It's a lot of them are immunocompromised because they're taking prednisone as an anti-inflammatory for other things like COPD, etc. So it's caused by this varicella zoster virus, which is the chickenpox virus, and it goes dormant in the neurons and it's never expelled. So that's why it's one of the herpes viruses, and then it's reactivated later and causes this thing called shingles. Now, it's like any other herpes virus in that time, age, stress, impaired immunity, any sort of physiological stress like trauma or disease can all make this come up. It is a viral infection, but it's this reactivation of a viral infection. So to anybody that's never been exposed to chickenpox virus or doesn't have a vaccine against chickenpox virus, it is communicable because the virus is now active and being shed. Fortunately, most of the population outside of kids have either the vaccination or have been exposed, so it really isn't considered all that communicable, although theoretically it is. So very, 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 very painful. Pain is the overriding thing, and just like cold sores, there's a couple of days where it stings and is tingling and things don't quite feel right, and then the blisters come out and then it scabs over and then it heals. But the pain lasts a long, long time. My father-in-law had it, and he had the blisters and such for a few days, but the pain lasted 6 or 8 months. It was a really long time, and it was really very, very painful, and he tried all kinds of different things to do it. Now, he was immunocompromised because he was taking prednisone for his COPD, so that was a problem. Now, he was admitted to the hospital for this pain, and they were pretty much convinced it was a herniated disc, because he was admitted to the hospital with all this pain before the blisters erupted. Now, if you catch this in really early stages, there's effective medications that work. So you got kind of like 48 hours, and then after that, you're kind of screwed. It has to run its course. The problem is that it's got to be diagnosed almost immediately, even before the blisters, just when there's just some redness. And so it takes a real watchful eye to understand what it is. and it frightens people, and because it happens to older people, it can be very frightening and confusing and debilitating. This is a picture of an outbreak of it. Now, one of the things that you need to note is that because it's in a sensory neuron and it's in the skin, it follows dermatomal patterns, that the rash will actually map out the dermatome of the affected nerve root. And it can be just about any nerve root. It doesn't just have to be on the trunk. So any sensory neuron can be affected by this. My wife's uncle had shingles in his optic nerve, and it ended up, of course, in the retina and in the dendrites of the sensory neuron, and he had to have his eye removed. He had to have it amputated. He has a glass eye now because of the herpes. So it can happen in auditory, so the vestibulocochlear nerve, and in one of a number of nerves. So it's blisters up and the skin is compromised, so therefore bacterial infections, secondary bacterial infections, are a common sequela to this, and something that they're quite worried about. And there can be permanent hearing loss, there can be blindness, there can be paralysis of the face, etc., etc. And then in extreme cases, the virus can shed into the blood, and they get viremia, and it can be life-threatening. It can be a horrible thing. The pain that outlasts is called post-herpetic neuralgia, and kind of the older you are, the more immunocompromised you are, the more at risk you are to PHN. And again, that's what my father-in-law ended up having, and it lasted for months and months and months. I don't think he ever really truly got over it. He passed away probably within 2 years of getting the herpes, and I don't think he was ever completely free of the shingles pain. So there are drugs that they give. It shortens the duration and means that you probably won't get the post-herpetic neuralgia. Acyclovir is the drug, but it has to be given right away, very early in the course of the disease. So that means it has to be found, and we're talking within 48 hours, and then the drug given. Unfortunately, too many people, they hope that it's going to go away for a couple of days, then they call the doctor, and they have to wait 3 or 4 days to see the doctor. If it happens on a weekend or something like that, they don't want to go sit for hours and emerge. So quite often it's too late to do the acyclovir. So then really what they give these people are strong painkillers, like even like the opiates. I think that my father-in-law had morphine at one stage in it. They give people steroids. Now the steroids help in one way with the inflammation and that's caused by it, but in the other way they make you more immunocompromised. So I don't know. It's a toss-up as to what you do. Various lotions and things might soothe the pain a little bit, but not really. We tried a lot of different things, and I've had lots of patients with this, and none of them get any decent long-lasting relief, just maybe momentary relief. So when it's all blistered up, you're not going to want to massage that. It's going to just irritate. It's going to be bad, but at the site, people probably can't even lay still that long. If you have the post-herpetic neuralgia, then perhaps massage would be indicated to help soothe some of the spasms and pains. So that's shingles, herpes zoster.